If you're over 60, taking vitamin B12 every day, and your legs still feel weak, cold, numb, or heavy, I need you to pause this video for 1 second, because what I'm about to say may explain why your circulation and nerves aren't improving, even though you're doing what you were told. I'm Dr. Alaric, and I've worked with seniors for over 2 decades, and I can tell you this. The problem is almost never that B12 doesn't work. The problem is how it's being taken. I know how frustrating this feels. You're doing everything right. You bought the supplement. You take it faithfully. But the tingling hasn't stopped. The coldness in your feet persists. And maybe you've even wondered if something more serious is going on. Here's what I'm going to show you today. First, why B12 often looks perfectly normal on blood tests but still fails to support your nerves the way it should. Second, the single most common B12 mistake that seniors make without even knowing it. Third, how to take B12 so it actually supports circulation and nerve repair. And finally, when B12 really does help, and when something else might be going on that needs attention. This isn't about blame, it's about understanding what your body needs now, at this stage of life. Let me give you a picture of what B12 actually does inside your body. Think of your nerves like electrical wires. They have a protective coating called myelin. B12 helps build and repair that coating. Without enough usable B12, that coating starts to break down, and when it does, signals don't travel properly. You get numbness, tingling, weakness. B12 is also deeply involved in making healthy red blood cells. Those cells carry oxygen, and your legs, being the farthest from your heart, need strong circulation and healthy oxygen delivery to feel normal. Now here's the part most people don't realize. After age 60, your stomach produces less acid. Your gut absorbs nutrients differently. And a protein called intrinsic factor, which helps you absorb B12, often declines sharply. So even if you're eating B12-rich foods or taking a supplement, your body may not be pulling that B12 into your bloodstream and nerves the way it did when you were younger. That's not your fault. That's biology. Let me tell you about Margaret. Margaret was 71 when she came to see me. She'd been to 3 doctors already. Her feet burned at night. She felt dizzy when she stood up, and her legs felt like they belonged to someone else. Every single time, her blood work came back normal. Her B12 level was right in the middle of the reference range, so her doctors told her not to worry. But Margaret knew something was wrong. And here's what I explained to her. A normal B12 test measures the total amount of B12 floating around in your blood, but it doesn't tell you how much of that B12 is actually getting inside your cells, into your nerves, where it needs to work. There are 2 forms of B12 in your blood. There's the active form, which your body can use immediately, and there's the inactive form, which your body has to convert first. Standard tests don't separate those 2, so you can have a normal total B12 level and still be functionally deficient at the cellular level. When someone tells me, "Doctor, they said my labs were fine," I know how frustrating that feels, because you're living with real symptoms. And you're being told there's nothing wrong. Here's what I look for instead. I ask about symptoms that show up early, before a blood test would ever flag a problem. Things like a slight burning or tingling in the feet that comes and goes. A sense of imbalance that wasn't there a year ago. Cold legs, even in warm rooms. Trouble remembering names or words more than usual. These are the whispers. And if we ignore them, they get louder. Margaret's case taught me something important. She wasn't ignoring her body. Her body was trying to tell her something that a single blood test couldn't capture. We changed her approach, not because the test was wrong, but because the test wasn't asking the right question. Within 8 weeks, the burning in her feet had decreased. The dizziness improved. She told me she felt like herself again. I'm not saying blood tests are useless. I'm saying they're incomplete, especially for seniors. If you've been told your B12 is normal, but you still have numbness, weakness, or circulation problems, that doesn't mean you're imagining things. It means we need to look deeper. Your symptoms matter, and they deserve real answers. Now let's talk about the form of B12 you're actually taking, because this is where most people get stuck without realizing it. Most B12 supplements you'll find in a drugstore are tablets. You swallow them with water, they go into your stomach, and your body is supposed to absorb them. But here's the problem. To absorb B12 from a tablet, your stomach needs to produce enough acid to break it down. Then, your gut needs to release that protein I mentioned earlier, intrinsic factor, to escort the B12 across your intestinal wall and into your bloodstream. After age 60, both of those things decline, sometimes dramatically, so you're swallowing B12. But your body can't pull it out of the tablet. Let me tell you about Robert. Robert was 72. He'd been taking the same B12 supplement for years. It was cyanocobalamin, the most common synthetic form. 1 tablet every morning with breakfast. But his balance kept getting worse. He'd trip over nothing, his legs felt unsteady, and he was starting to lose confidence in his own body. When I asked him about his supplement, he showed me the bottle. It was a standard tablet, and it required stomach acid and intrinsic factor to work. Here's what most people don't know. Cyanocobalamin is a synthetic form. Your liver has to convert it into methylcobalamin or adenosylcobalamin before your body can actually use it. That's an extra step, and for some seniors, that conversion doesn't happen efficiently. I suggested he switch to a sublingual methylcobalamin. That means it dissolves under the tongue. It bypasses the stomach entirely. It goes directly into the bloodstream through the tissues in your mouth. Robert was skeptical. He said, "Doc, I've been taking B12 for 5 years. Why would this be any different?" I told him, because your body at 72 is not the same as your body at 67. He tried it, and within 6 weeks, his balance started to improve. The unsteadiness decreased. He told me he felt more grounded. He wasn't careless. He was doing exactly what the bottle told him, but the bottle didn't know his stomach wasn't absorbing it anymore. Here's what I want you to understand. This isn't about one form being universally better. It's about matching the form to what your body can actually process at this stage of life. If you're over 60 and you're still taking a standard tablet and your symptoms haven't improved, it's worth asking your doctor about switching to a sublingual or even a spray, because effort without absorption is just effort. Now let's talk about something that seems small but makes a massive difference: timing and consistency. B12 is not a pick-me-up. It's not something you take when you feel tired and skip when you feel fine. B12 is a repair tool, and repair takes time. It takes daily, consistent input. Let me tell you about Elaine. Elaine was 70. She bought a good quality sublingual B12, methylcobalamin. She knew the right form, but she only took it when she felt exhausted, 2 or 3 times a week. Sometimes she'd go 5 days without it, and her symptoms stayed the same. Tingling in her feet, heavy legs, brain fog. When I asked her about her routine, she said, "I take it when I need it." And I said, "Elaine, your nerves don't know when you need it. They need it every day to rebuild." Here's why consistency matters. Nerve repair is a slow process. The myelin coating I mentioned earlier doesn't rebuild overnight. It rebuilds in tiny increments, day after day, as long as your body has the raw materials it needs. If you take B12 sporadically, you're giving your nerves just enough to pause the damage, but not enough to reverse it. Think of it like watering a plant. If you water it once a week, it survives, but it doesn't thrive. Consistent daily watering lets it grow. I also see people take B12 at night, right before bed. And for some, that's fine. But for others, B12 can be slightly stimulating. It supports energy production at the cellular level, so taking it late in the evening can interfere with sleep. I usually recommend taking it in the morning or early afternoon. Let it support your body during the active part of your day. And here's something most people miss: hydration. If you're dehydrated, your circulation slows, your blood becomes thicker, and even if you're absorbing B12 properly, it's not getting delivered to your nerves as efficiently. I tell my patients to drink water throughout the day, not all at once, just steady, small amounts. Also, certain medications can interfere with B12 absorption. Proton pump inhibitors for acid reflux, metformin for diabetes. If you're on those, you need to be even more intentional about your B12 routine. Elaine started taking her B12 every single morning. she set a reminder on her phone, and she drank a full glass of water with it. Within 3 months, the tingling stabilized. The heaviness in her legs decreased. She told me, "I didn't realize how much I was working against myself." This isn't about perfection. It's about giving your body what it needs, when it needs it, in a way it can actually use. B12 isn't a pick-me-up, it's a repair tool. And repair requires patience and consistency. Alright, let's make this practical. Here's what I want you to try this week, safely, and with your doctor's guidance if you have medical conditions or if you're unsure. Step 1. Check the form on your bottle. Look at the label. Does it say cyanocobalamin or does it say methylcobalamin or adenosylcobalamin? If it's cyanocobalamin and you're over 60, consider switching to one of the active forms. Step 2. If it's sublingual, place it under your tongue and let it dissolve slowly. Don't chew it. Don't swallow it right away. Let it sit under your tongue for at least 30 seconds. That's how it enters your bloodstream directly. Step 3. Take it earlier in the day with water. Morning or early afternoon is ideal, and drink a full glass of water with it or shortly after. Step 4. Take it every single day, no skipping. Set a reminder if you need to. Put it next to your toothbrush. Make it part of a routine you already do without thinking. And here's the part I can't skip. If you have kidney disease, if you're on blood thinners, if you have a history of certain cancers, or if you're on medications that affect absorption, talk to your doctor before you change anything. This is general guidance. It's not a prescription. Your situation is unique, and your doctor knows your full medical picture. The goal here is simple. Make it easy, make it consistent, and give your body the best chance to use what you're giving it. Now I need to talk about the warning signs that mean you need to see a doctor right away, not next month, soon. If your numbness or weakness is getting worse despite making changes, that's a red flag. If you're having balance problems or you've had more than one fall recently, don't wait. If your symptoms are only on one side of your body, that's not typical for B12 deficiency. That could be something neurological that needs urgent evaluation. If you're experiencing new bowel or bladder control issues, that's serious. That's not something you manage at home. And if your symptoms keep progressing even after you've switched forms, improved consistency, and given it time, we need to look for other causes. B12 deficiency is common, but it's not the only thing that causes numbness, tingling, and circulation problems in the legs. Diabetes, peripheral artery disease, spinal stenosis, autoimmune conditions, all of these can mimic B12 deficiency. That's why I always say, start with the simplest, safest intervention. But don't ignore worsening symptoms. Your body is trying to tell you something, and sometimes that something needs professional evaluation. I've watched people lose confidence in their own legs. That fear is real, and it matters. When you can't feel your feet properly, you start to question every step. You avoid stairs. You stop going places you love. You become smaller in your own life, and that deserves real answers, not dismissal, not guessing, not being told your labs are fine when your body is telling you otherwise. I want you to know that what you're feeling is valid, and there are ways to support your body that go beyond just hoping things get better. Sometimes it's the form, sometimes it's the timing, sometimes it's consistency, and sometimes it's something else entirely that needs attention. But you deserve to know, and you deserve to feel steady and strong in your own body again. That's why I do this work, because I believe understanding is the first step to healing, and healing starts with being heard. Here's something I've noticed in my clinic. Some seniors feel better in just a few weeks after making these changes. Others take months, and a small group doesn't notice much difference at all. Why do you think that difference happens? Is it the severity of the deficiency, the form they're using, something about their individual biology? Tell me in the comments below. I'm genuinely curious what your experience has been. Let me answer a few questions I get asked all the time. Should I just get B12 injections instead? Sometimes, yes. If you have severe malabsorption, if you've had gastric surgery, or if oral forms aren't working even with the right form and consistency, Injections can be incredibly effective, but many seniors don't need them. Sublingual methylcobalamin works beautifully for most people if it's taken correctly. Injections are more invasive. They require a doctor's visit or self-injection, and they're not always necessary. Start with what's least invasive and see how your body responds. You can always escalate if needed. Can I take too much B12? B12 is water-soluble. That means your body excretes what it doesn't use through your urine, so toxicity is rare. That said, I don't recommend megadosing without a reason. More isn't always better, and extremely high doses can sometimes mask other deficiencies like folate. Stick to the recommended dose on the label or what your doctor advises. Sensible dosing is still the wisest approach. Why do my legs suffer more than my hands? Great question. Your legs are farther from your heart. They require more circulation effort. The nerves in your legs are also longer, and longer nerves are more vulnerable to damage when B12 is low. It's not that your hands are immune, it's just that symptoms show up in the legs first because they're under more demand. Think of it like a long garden hose. The water pressure is strongest near the source. By the time it reaches the far end, any blockage or weakness shows up more clearly. Your legs are the far end. That's why they're often the first to signal a problem. Let me bring this all together. If you're over 60 and you're taking B12 but still experiencing numbness, tingling, weakness, or poor circulation, the problem is almost never that B12 doesn't work. The problem is usually the form, the consistency, or the way your body is absorbing it. Check the label. Switch to sublingual methylcobalamin if you're still on tablets. Take it every single day in the morning with water and give your body time to repair. But also, listen to your body. If symptoms worsen, if you're falling, if things aren't improving after a few months of doing this right, see your doctor. Because B12 isn't the only answer, and you deserve a full picture. Understanding beats guessing. Every single time. If this video helped you, I'd love for you to subscribe to this channel for clear, honest senior health guidance that actually makes sense. Leave a comment below and tell me what your experience with B12 has been. Have you noticed a difference? Are you still struggling? Let's learn from each other. And if you know someone who's dealing with numbness, tingling, or leg problems, share this video with them. Sometimes the smallest change makes the biggest difference. Thank you for trusting me with your time. I'll see you in the next one.